This is On Air with EUFOREA.
Hello. We are on the EUFOREUM in Berlin on respiratory care in type 2 driven disease from childhood to adulthood. My name is Susanne Lau. I'm a pediatrician from Berlin, and it's a pleasure to have a little chat with Monika Gappa, current president from the European Respiratory Society, also pediatrician and pediatric pulmonologist. And yes, I think one of the exciting news is that we learned a lot about unmet needs on the one hand, but also on very exciting therapeutic options in T2-driven diseases, mainly respiratory, but also a little bit about dermatological aspects of atopic dermatitis and chronic spontaneous urticaria. But, well, as pediatricians, we, of course, want to treat our patients very well and also early. We want to detect the disease early. However, Monika, what's about prevention? Do you see any new option on any new approaches in terms of prevention or early modification of allergic diseases, respiratory T2-driven diseases?
Well, thank you, Susanna. I think this is an excellent question. As a pediatrician, we both know that the immune system starts to develop in utero and then continues to develop, driven through environmental factors, genetics, infections, to adolescence and then adulthood. And of course, as pediatricians, we have the opportunity to prevent. When we talk about T2-driven diseases, we know it's a bit of genetic background, and it's also influenced by environment. And this environment starts in utero. And so prevention has to start in utero.
I mean, I think we have two aspects. One aspect, what can be done on the basis of the general population, which would implement environmental control, for example. And on the other hand, of course, we can also focus on certain risk groups. Starting with the general population, what would you recommend to address dramatically?
Well, the most important thing that we all need to address and continue to address is tobacco smoke exposure. This is something the parents can take responsibility for their own child. This starts even before you think about having children, which is quite difficult to explain to people. We know that if the father of the child smoked by the age of 15 and stopped maybe in his 20s, then there's still a risk for the child, an increased risk to develop asthma. But any smoker stopping in front of a child will change the development of the immune system, development of the respiratory system. And there are really good data that with better tobacco legislation, respiratory diseases come down in children, especially in young children.
Yes, and even the epigenetic impact over generations can be observed. I mean, there are some data on the smoking grandmother.
Yes, exactly.
Where you see the epigenetic changes in terms of switching on certain inflammatory genes can still be observed in the grandchildren generation. And that gives us really the need or the task to reduce smoking rates in the world. But we start in Europe, hopefully. And I think we have to have less tolerance. I mean, if I observe Berlin, for example, we are very tolerant if people smoke in front of the children's hospital, for example. And I think we should take care of our children. And tolerance is nice, also immunologically, but sometimes tolerance towards certain behavior is not good, is really doing harm. And, well, it saves a lot of money if you stop smoking.
Yeah. And actually, I think it's important to say that the same is true for the alternatives, the e-products, containing nicotine, e-tobacco. So, but this is sort of the part that we can influence ourselves. But there's also the overarching theme of environment, climate change, and air pollution this is something we have to give to the politicians to improve legislation. And I know that a lot of action is going on, especially from allergists and respiratory physicians. We've been talking a lot about advocacy, and we cannot raise our voices enough to make the society aware of the importance of climate change, air pollution on development of allergy and respiratory diseases.
Absolutely true. But we could also again focus on small steps like media consume. I mean, we see a lot of babies already, infants, sitting in front of their tablets, not moving them normally, but being sort of paralyzed in front of little stupid videos. Sorry to say that. And I think one simple step could be that we educate parents more. We have really to reach them to understand that simple measures can do really good in terms of avoidance of obesity, which is a risk factor for different diseases, but also for respiratory diseases. And I think, these simple steps should also be taken, although we know that immunology is so complex, but I think we should start with the small steps in behavior, for example.
Yes, get them back to soccer clubs
sports.
And
playing.
They have
outside.
to do sports.
Yeah.
And the sedentary behavior will mask asthma. That's one thing, and may, with increasing obesity, increase the risk for asthma. So it's a really double impact, and that's something we need to do as pediatricians. Yes.
Yes, and one other aspect is, of course, city planning, improving the local urban climate, more plants, which are hopefully then not producing too many pollen allergens, but also avoiding the pavement of big surfaces to improve the microbial diversity in especially the urban population, which also has to be addressed in future.
And talking about microbial diversity, this brings us to a more medical intervention, prevention. We know that the microbiome is very important in terms of immune development, and there is now increasing interest in using probiotics and bacterial lysates to modulate the immune system with the aim to have less allergies and less respiratory disease. So this is another really exciting aspect of prevention, but we need to wait for the study results before we can recommend this either on the population level or to specific risk populations.
Yes. So thank you very much for this interesting conversation.
This was brought to you by EUFOREA, inspiring the future of respiratory care. This podcast was supported by an unrestricted educational grant from Sanofi Regeneron.